Hi friends, I am Mitra and welcome back to my channel. In this video we are going to see about Cushing everything. I mean all the terms that start with Cushing, like Cushing syndrome, Cushing disease, Cushing reflex, etc. Cushing syndrome is hypercortisolism, which means essentially there is increased levels of cortisol in the body. The cause may be anything. Most commonly the cause is iatrogenic, and it is followed by tumors of adrenal cortex. So there will be increased in the cholesterol levels. The signs and symptoms are increased BP, weight gain. There can also be the classic buffalo hump, moon faces, and purplish striae, excessive sweating, excessive hunger, and easy fatigability. All these are signs and symptoms of Cushing syndrome. Remember, most common cause is iatrogenic, which results when steroids are used for treatment for long periods of time. Now, we have covered the main thing of this, and let's move on to the next one, which is Cushing disease. Cushing disease is one small part of Cushing syndrome. We have seen two causes here, and Cushing disease is hypercholesterolism due to central cause, which means there is pituitary tumor. This pituitary tumor is mostly benign, and this pituitary tumor secretes excessive ACTH. This increased ACTH goes and stimulates the adrenal cortex to release more cortisol, and it leads to the symptoms. So you can see that Cushing syndrome is like an umbrella covering Cushing disease. Cushing disease is one cause of Cushing syndrome. So this is a part of this, and this is the main umbrella encompassing all the causes. Now let's move on to the next and important one, which is Cushing reflex. Cushing reflex is a physiological vasopressor response of the body when there is increased intracranial pressure, like when there is traumatic brain injury leads to raised intracranial pressure, subarachnoid hemorrhage, and hemorrhagic stroke. These are some of the causes when there is increased intracranial pressure, which leads to Cushing's reflex. Now, in Cushing's reflex, as a response, the body displays Cushing triad. This is a triad of the response which the body is showing when there is increased intracranial pressure. Now, in Cushing triad, there is increased BP, bradycardia, and irregular breathing. Cushing reflex includes Cushing triad. These are three main symptoms which are seen as a result of body's response to increased intracranial pressure. Now, Cushing reflex is not only known as Cushing reflex. Here comes the confusion. Cushing reflex has many names. Now, just take the reflex and replace it with reaction. Cushing reaction, Cushing law, Cushing effect, Cushing phenomenon. All these are one and the same. You need not be confused at all. If any Cushing response, reaction, like reflex, effect, phenomenon, law, everything is same, which is the body's response to raised intracranial pressure. And because of that, what we get Cushing triad. There is increased blood pressure, reflex bradycardia, and irregular breathing. This is the main triad. So uh, let's move on to the next one, which is Cushing ulcer. Cushing ulcer. Cushing ulcer is gastric ulcer seen due to raised intracranial pressure. This is totally different from the above. All these are very slightly different, and that you have to remember the slight differences and you will not be confused anymore. These two are slightly related, and this is included in this. Cushing disease is included under syndrome as it is a central cause. Cushing reflex, all these four and this, all these are same, and which give rise to Cushing triad. This is related to raised intracranial pressure. This is also raised in this is also related to raised intracranial pressure, and this is also known as von Rokitansky Cushing syndrome. Now, this Cushing syndrome is entirely different from that Cushing syndrome. That Cushing syndrome is because of hypercholesterolism, but this is the ulcer because of the raised intracranial pressure, and this is known as von Rokitansky Cushing syndrome. So, friends, don't be confused. Cushing syndrome is a broader term including Cushing disease and other causes, and Cushing reflex has many names. Mm, and if anything like Cushing effect, Cushing response, just blindly, all those are one and the same, and it is because of increased intracranial pressure. And Cushing triad includes increased blood pressure, bradycardia, and irregular breathing. This Cushing triad is seen when Cushing reflex is initiated by the body. And Cushing ulcer is gastric ulcer seen due to raised intracranial pressure. And this condition is also known as von Rokitansky Cushing syndrome. And here we have to mention one more thing, that is curling ulcers. Curling ulcers are stress ulcers seen due to burns, and uh, most of the times we get confused. So remember that here, uh, here and here we understood that Cushing is related to raised intracranial pressure, reflex, and ulcer. So Cushing you can remember as related to raised intracranial pressure. Curling, if you want to remember like when you're burning something, it curls up. So curling ulcer is gastric ulcer because of burns. So that's all for this video, friends. I hope that this cleared up Cushing syndrome for you, and I hope that you will never be confused again. So see you in my next video. Bye.